Hi and welcome. This is the third of 5 sessions where we will be talking about evidence-based practice. So today's lecture is called Appraise, and this is the third step in the EBP process. My name is Sarah Villery, and I'm part of your library instruction team here at Red Rocks. I'm also a nurse practitioner and worked for over 10 years in direct clinical care before switching to information science. So here's our agenda for today. I'm going to first provide a recap of what we covered in session 2. Then we'll talk about appraise, including how to assess the validity, reliability, and relevancy of a study. We'll go through some of the critical appraisal tools that can be really useful when you start to do this on your own. And then we'll discuss what comes next. So as I mentioned in both of the last sessions, and I'm going to keep mentioning, as Arvada students, you have full access to the Red Rocks Library. So we have a library here on campus, an office that's staffed 2 days a week, Wednesdays and Thursdays from 9 to 4. You can also book a one-on-one appointment with us for research help. It can be in person or virtual. Just scan this QR code here. You can also go to this link, which is a form to reserve the book a librarian appointment. I want to mention that Red Rocks did get a new school website. And so right now, the book a librarian form is not available on the new website. We are working on this, but please save this QR code. It does still work. Um, I wanted to put this lesson into context. So recall we talked about the 5 A's of evidence-based practice. So this is the framework that we can actually use to connect research and theory to our practice. So we've already covered the first steps, ask, acquire. Now we are on to the third step, appraise, where we are critically appraising the validity, reliability, and usefulness of the evidence. So in session 2, we talked about that second step in the framework, acquire, which really means how to search for research. So we covered where to find information, meaning which resources to use for your search, how to build a search strategy. So really translating your research questions into search terms. And then we also talked about some searching tips using Boolean operators like and, or not, using quotation marks, using truncation. We covered how to find evidence by searching a relevant database. And specifically, we looked at Access Medicine and Nursing and Allied Health Premium, which are both available through the library webpage. And then finally, we talked about how to access the research. So how to view it, how to download it, or save a full text. If you have any questions about any of this, I encourage you to rewatch the recording. That really sets the stage for today's lecture, but you can also reach out to us at the library with any questions. So now that you've asked your question, you found your evidence, the next step is appraise, which means critically appraising the validity, reliability, and usefulness of the evidence. So this step is really about understanding the results of your search. It's a systematic way to judge the strength of your evidence in relation to your question. And it looks for any methodological flaws or potential biases, and it helps you make sense of the results. So as you do your literature search and you find articles of varying types, how much faith can we really have in the results of those articles? Oftentimes, results can even be conflicting, where one study says one thing, the next study contradicts it. How can we make sense of this and really weed out the quote unquote good studies that you know that you can trust? We know and we learned that not all evidence is created equal. And ultimately, it is up to us, the readers, to decide which studies to trust enough to actually make changes to our practice. So that's where critical appraisal can be helpful. This is important because it makes sure that you're using research that's true, meaning it's free of bias, or at least that bias is minimized, and that it's relevant to your patient. So this way, you can use the evidence really efficiently and continue on to apply it to your practice. So to get started, I wanted to talk through some essential questions or elements that you should consider with every single article that you read. There is a structured way to appraise an article using checklists, which we are going to get to in a few slides. But I think having a general idea of what you're looking for when you appraise an article is really useful. So the questions are, what is the research question? What is the design of the study? Is the study valid? What are the results? Does this study apply to my situation? And we're going to talk about each one of these a little bit more in depth. So the first thing you want to look at is, what is the research question? Does this study address a clearly focused question? And what is it? Why was the study done? So think about your PICO elements. What's the population, the intervention, the comparison, the outcome? This can usually be found at the end of the introduction or background section. And a lot of times authors may also include secondary questions and outcomes that they're looking at, but really focus on the main research question and the main outcome. Because if their research question and outcome doesn't match what you're looking for, you can stop there. So it may not be an article that would be helpful for your search. If you're looking at lung cancer rates in people who smoke, for example, and you find an article about oral cancer rates in smokers, that may be interesting, but it doesn't exactly match your information need. And so you probably don't need to read any further. It's not going to answer the question that you're looking for. The next thing that you want to think about is, what is the design of this study? So what type of study was done? And specifically, was this an appropriate study method to answer the research question? So in the previous sessions, we talked about how ideal study design is based on the type of research question you're asking. So for example, if you're looking for a drug study to see if an injectable HIV medication is as effective as the oral route for that same medication. A qualitative study that interviewed patients taking the medication really would not be an appropriate study design for that question. Instead, this is an intervention type question. So we can look at this chart and see that we would want a randomized control trial on that topic instead, right? We could also look for a cohort study or a case control study. But a qualitative study really is not appropriate in this case. So if I found an article asking that question and then using a qualitative study design, you can probably stop. That may not be a good article for you. It's, the study design does not match the research question in that case. Okay. This essential question also brings us back to the levels of evidence pyramid that we talked about in previous sessions. So you will probably find multiple articles with different study designs that all address your question, though maybe in different ways. And how can you piece through that, right? If they're all appropriate study designs, are they all created equal? And recall that we learned that this is not the case, that not all evidence is created equal. And knowing how to evaluate and rank the authority of different research methods is really important. So higher levels on this pyramid are more rigorous and have less risk of bias. So they're stronger studies, right? If you're looking at that HIV drug and you find 3 different articles, one is a randomized control trial, one is a cohort study, and one is a case control study. Recall that all 3 of those would be appropriate for that research question. The randomized control trial study is going to be higher on this pyramid. So that would be considered stronger evidence for this question. It doesn't mean that we can't learn something from the other studies, but the randomized controls trial would have higher authority, if you will. So if there's some contradictory evidence provided in those studies, then the randomized control trial is going to rank a little bit higher. So we found a study that has a clear research question. It has an appropriate study design. Next, we want to ask ourselves, is this study valid? So what that means is, was the study conducted so that the results are actually true? So how well does this study measure the outcome that it set out to measure. Here we're really assessing for bias. And if it's in a study, what was done to address it or reduce it by the authors or by the researchers? So bias is something that the author did wrong or an error within the study that may cause the results not to be true. So it can actually bring about false conclusions. So in other words, the bias or error may have actually caused the outcome instead of the intervention. So bias can really threaten the validity of a study. It can affect the interpretation of the results, and often it actually exaggerates the effects of the intervention. So, one example would be if we were researching a link between asthma and air pollution, and the sample that was used is 90% current smokers. So, it could be that the smoking is what actually caused the asthma instead of the air pollution. And so, did the researchers take this into account? How did they adjust their study to try to reduce this bias? Maybe they needed to consider more specific inclusion or exclusion criteria. Maybe instead of randomization, they could have used representative samples so that the same number of smokers are in both the control and the intervention group. There's a lot of different ways that researchers can control for bias. So, what your job is as an appraiser is trying to call out bias in the study and then see if the researcher thought of that and what did they do, if anything, to minimize it. So next you want to think about what are the results of the study. So what do the authors present as the findings? And are the outcomes that are measured actually relevant? Was there a treatment effect? And if so, was it statistically significant? So you're reading to understand the significance and magnitude of the results. Here you may see some descriptive statistics. So this tells us who was in the study. It's often presented with means, medians, standard deviations. You may see inferential statistics, which is where the author is comparing one group with the other group to see if the intervention makes a difference between the groups. And if so, how much? So you may see odds ratios, relative risk, p-values, confidence intervals. The authors may present the results textually. They may use tables or graphs, sometimes a combination of this. One thing that you want to check for is that the graphs don't have any inconsistencies or misrepresentations that can mislead you. So sometimes the researchers can manipulate the axis or scales to make it look like there actually was a big difference when the p-value shows that the results were actually not significant. So for example, these two graphs are showing the same data, but the graph on the top has a y-axis that starts at 0. And then the graph at the bottom has a y-axis that starts 2 standard deviations below the mean. And so you can see how dramatic the truncated y-axis makes the data change look, when in actuality, the data itself may be telling a different story. So you as the reader want to see, how does the author present the data story, right? You should be able to understand what that story is and understand how it relates back to the research question. So, assuming that your study is valid, you understand what the results are, you finally have to think about, does this apply to my situation? So, applicability means really, does this apply to my patient now? Are the results relevant to my current situation? Meaning, are the subjects included in this study like my patient? Could my patient have gotten into this study? Do they meet the inclusion exclusion criteria? Does the outcome of this study matter for them? So we want to ask these questions because we want to see if these results can be used to make decisions about this patient's care. Alternatively, you may be researching to stay up to date with your practice, and maybe you don't have a patient sitting in front of you, but you're looking to learn something that may be generalizable, meaning that this could be applied to patients in the future. So, can you use this information to make informed decisions about across other similar situations in the future in your practice? So while you do need to ask the right questions as you're appraising your evidence, the good news is that you don't need to come up with these yourself. So there's a number of different critical appraisal tools and checklists out there to help you answer these questions and really assess the quality of the study that you're looking at. So I'm going to show you three different ones today. I will also link them in the research guide at the end of the presentation. I think it's really helpful to try a couple of them out to see which one you feel the most comfortable with. They're all similar, but they have slight differences. And so once you find one that you like, you can have it pulled up or printed out as you go through your articles. So the first one is called the JBI Critical Appraisal Tool. So JBI is a global organization that promotes and supports evidence-based practice, and it has one of the most comprehensive set of checklists available with 15 different checklists. So to get to the JBI checklists, you will follow the webpage that I've linked in the research guide. Or you can also search for JBI Critical Appraisal Tools. But this is what it's going to look like. So if we scroll down, we can see that they have different checklists for different types of studies. So for this example, we are going to look at the randomized controlled trial checklist just so that we can compare these tools across the different sites. But you could download any of these for free to use depending on what type of study you're appraising. So let's go to the randomized controlled trial section. And this is the PDF that we can download. Or I think it's a Word doc, actually. But you'll see that it pulls the tool up for you. The JBI checklist first page is going to be just an introduction about JBI, about these tools, how they were developed. But then you will scroll down and see the checklist actually start. So all of these questions you will go through and look for the answers in the article that you're appraising. And you will check yes, no, unclear, or not applicable about your article. So for example, in this checklist, the first question was true randomization used for assignment of participants to treatment groups. And so this is really checking for that selection bias. If your study had true randomization, then you can click yes. If you're not sure, or if you notice that it does not, then you could click one of these corresponding check boxes. So if at the end of the checklist, you have most answers yes, then that's a good article, right? They're not all going to be yes, but most of them should be yes. If you have mainly no's or it's unclear, then maybe you want to reconsider using this study. Scrolling down to the bottom of the checklist here, you'll notice they have what's called question guidance. And this is really giving you more explanation to each of the questions so that if you have a question that you're not sure of, or you don't understand why this is an important question, you can come down here and it's going to tell you a little bit more about it, as well as what you should look for as the reader so that you feel confident that you're answering this question correctly. So the next checklist that I want to show you is through CASP, the Critical Appraisal Skills Program. So this has 11 different checklists, and it's one of the most commonly used tool for health-related evidence appraisal. So if we go to their webpage, again, you scroll down and can see a list of the checklists that they have available to download for free. I am going to click on the randomized controlled trial checklist. I'll pull up a word just so that we can see what that looks like compared to the GBI. The first thing that I want to point out here, I'm actually going to read this note here. So it says, during critical appraisal, never make assumptions about what the researchers have done. If it's not possible to tell, use the can't tell response box. If you can't tell, at best, it means the researchers have not been explicit or transparent. But at worst, it could mean the researchers have not undertaken a particular task or process. Once you finish the critical appraisal, if there are a large number of can't tell responses, consider whether the findings of the study are trustworthy and interpret the results with caution. And I think that this is really important because it's really why we go through these checklists. It's because we want to see if this is a trustworthy article, and if it does not meet the criteria of these checklists, then we really need to proceed with caution if this is an article that we're actually using to change our practice around. Okay. Scrolling down just to look at what this checklist looks like, it's broken up into different sections. They've actually listed the guidance directly under the question so that you can see a little bit about what the question is asking and what you should be looking for in your article. So the first question here, did the study address a clearly formulated research question? Yes, no, or can't tell. You have room to make notes on here if you'd like to, and then it tells you what you should be considering to really answer that question. You'll notice as you go through this one that it a little bit more closely follows some of the questions that we talked about today. And then at the bottom here, they also have a section where you can summarize what you found during the appraisal. So the last one that I want to show you is the CEBM, Center for Evidence-Based Medicine Critical Appraisal Tools. So CEBM is part of Oxford University. It's a renowned global center for evidence-based research and learning, and they have 6 different worksheets available. And they're available in English and multiple other languages, which is really nice. So if we go to their website here, and we can scroll down and see the worksheets that are available in English. And then right on this page is where you could find these in other languages as well. But let's go to the randomized control trial checklist so that you can see what it looks like. So they also have directly under their questions a little guidelines for you as you're going through the articles. So they're going to tell you what is an ideal answer to this. So what is the best way that this study could be set up for for the assignment of patients to treatments randomized. Okay. They're also going to tell you explicitly where you can find the information. So then you can click yes, no, or unclear as you're going through. This is also really neat as we scroll down to the results section here. They actually explain out what some of the statistical concepts are that you will be looking for in your randomized control trial, and they give some examples around that. So that's one thing that the other checklists don't have, and you can find that information elsewhere. But I think it's always helpful to have when you're going through the article and you find these terms and you're not familiar with them, to have it right here for you. So each of these checklists are really presented in slightly different ways, and you may have a preference to which one you use. They are all valid. They can all help you critically appraise the evidence. So pick one and make sure that you have it open or printed when you're reading through these articles. So now that we appraise the evidence, let's talk about what comes next. We've switched up how these lectures will be presented. So instead of scheduled in-person sessions, we'll be uploading these recordings for you to watch when you're able to on your own time. So the next recording will be on the 4th step in the process, apply, and then we will have one final recording on the 5th step, assess. Here is the link to the research guide that I've been referencing. On the appraisal tab, I've included these critical appraisal worksheets that we've talked about. I've also included an article that goes through this process with you using a specific study. So it's a really good example of what critical appraisal actually looks like, and you can practice a little bit alongside the article authors. And then I've also included some more information on research bias and how it can relate to evaluating the quality of research, and then some additional resources to help you understand the results. So specifically understanding the statistics used in research, and then how to spot a misleading graph. Thank you for watching. Please reach out to us with any comments or questions. You can also visit us in person at the Arvada or the Lakewood libraries. And we would love any feedback from you on this or any of our other sessions. So please fill out this form. It's available at the URL, or you can scan the code here. And it is really, really helpful to hear from you about what you liked, what you didn't like about these sessions so that we can continue to make this better. Thank you.